All right, we will get started. Probably expect some individuals to join a little bit later. So I just want to welcome everyone to the Pathways to Wellness Accessing Care webinar series. The Health Council of West Central Florida has designed this webinar series with the goal of addressing knowledge gaps for all individuals, regardless of insurance status. The webinars will highlight the array of healthcare services, programs, and insurance options for all individuals. And today's session, titled Health Insurance 101, will cover all the basics of health insurance, including terminology. So, a disclaimer before we get started: the views and opinions expressed in this webinar are solely those of the presenters and do not necessarily reflect the official policy or position of the Health Council of West Central Florida. The information in our webinars and e-materials, digital recordings, and other materials like our resource list is for general information and educational purposes only and should not be construed as an endorsement, recommendation, or promotion of any specific person, company, product, or service. Nothing contained in these materials is or is intended to be construed as advice. We are only providing you with techniques, tools, information, insights, and educational material to assist you in your personal life and navigation of accessing care and or health insurance. All right, so our speaker today is Victoria Kasdan. Victoria is a seasoned executive with over 30 years of experience in for-profit and nonprofit sectors. She is the current CEO and founder of Mission Made Possible LLC and is a registered nurse, former public health administrator, and retired health insurance executive. Victoria, thank you so much for being here with us today to share such valuable information. I will hand it off to you to get us started.
Well, thank you. I'm going to see if I can share this screen.
Yep.
We have the PowerPoint. Put it as full screen. Okay.
All right, looks good.
All right. Well, good afternoon, everyone. I'm Victoria Kasdan. I'm delighted to be here. I'd like to thank the Health Council of West Central Florida for the opportunity to share with you a little bit of information about the basics on health insurance. Now, this is not going to be everything you always wanted to know about health insurance in 50 minutes. It took me many, many years to learn some of the information that I'm sharing with you. I'm trying to provide it to you in a way that is easy to digest and understand. As Mari mentioned, this is not intended to provide you with everything you always wanted to know or be inclusive of all health insurance information. It's really for assistance and advice. So I'm going to just begin the presentation. And let me click through a few slides here if I can. Okay. This is for assistance with health advice, a health plan advice. It's not really intended to be advice with regards to tax and legal implications, because those would be very specific to your own needs. And if you have specific things that you need to discuss, I recommend you talk with a licensed insurance agent, of which I am, and also with a health insurance company or your HR benefits manager or tax advisor. Like I mentioned, it's hard to cover everything in 45 minutes, but we will cover a few basics, including the benefits of health insurance, common terms, a few examples of how it works, types of plans, and a few tips for selecting a good health insurance plan. Now you see these numbers here, they're pretty big, hard to get your head around when you think about $4.3 trillion, $1.6 trillion, or even $1.2 trillion. But this is where healthcare spends, and this source is the American Medical Association. So we're spending a considerable amount of money on healthcare. It's down a little bit from 2020, but it's still quite a bit of money. And you can see some of the distribution when you look at Medicare and Medicaid. So why do you even need health insurance? Well, the big thing is, if you don't have your health, you really don't have very much. It's a very valuable asset that is hard for anyone to give you and hard sometimes to even get. But health insurance does two major things. One, let's remember it reduces the risk of how much financial burden you have when you access healthcare. And it provides you access to providers, services, and programs that can prevent, treat, and help you manage health conditions that could impact your health or your well-being. Essentially, health insurance helps you protect your life and your livelihood. The cost is a big expense. Just the cost of healthcare is big, and you can see the numbers here. However, we're all paying for healthcare, whether you have health insurance or not, because if you're getting a paycheck of any type, you're likely paying what we call FICA. And FICA is actually around 15%. Now, if you're employed, your employer pays half of that 15%, and you out of pocket are still paying about 7% of your paycheck for healthcare services that you may or may not actually be getting at this time, things like Medicare, Medicaid. And that's not even including any private health insurance that you may take or health insurance that you may have through your employer. So in the end, we're all paying for it. And so then it's probably a good idea to know what you're paying for, to select the right plan that's right for you, for your loved ones, and to learn more about how to maximize your benefits. So we talk about how much is going into healthcare. And I'm looking at the slide saying, I think you should follow the money. Where is that money going to? The largest chunk is going for hospital care. And you can see that the next two largest areas are physician services and other personal health care. The fourth top is prescription drugs. Those can be quite expensive. But there are other categories that you can see on this slide as well. The difference on the one that is titled net cost of health insurance, well, that's actually the difference between what insurers incur or receive in premiums and the amount actually paid in benefits. This includes things like administrative cost, addition to reserves that they keep, rate credits, dividends, premium taxes, fees, net underwriting cost, gains and losses. If nothing else that you take away from this particular pie chart, please note that this slide is showing you that the cost of hospitalization can really break the bank. So how much do we spend, you as an individual? These numbers are averages. Your number may be more or less, but this is an average that every person is spending around close to $13,000 on average for healthcare each year. That includes things like your health insurance plans for yourself and your family, and then other additional costs that you may incur, like over-the-counter medications, medical devices, those types of things. And this information comes from the Kaiser Family Foundation, a very well-known, trusted, and credible source that provides information on health policy, research, polling, and news. So how does the average American spend their money? Well, an insured American adult with an employer-sponsored health plan insurance can expect to spend more than $320,000 over the course of your lifetime. Now that's your health insurance premiums and your other costs. So think in your lifetime, on average, you're going to spend close to $320,000. You probably want to know how health insurance works and how to maximize your healthcare spend. That can even be more than the $320,000 if you or someone in your family actually has a chronic disease. So what's the problem? Why are we spending so much on healthcare, and why is the cost continually rising? One of the reasons is increased demand. And that demand, some of that demand is actually coming from us. We have very high expectations of our healthcare system. We want the best, the most, the latest. We want to live forever, and we want the technology and innovation that'll help us do that. That doesn't come cheap. Then you've got rising cost. Inflation is still outpacing wages, leading to a bigger and bigger gap in healthcare affordability. We're getting less government support now, so you're incurring more out-of-pocket expenses as a consumer. There's still also, with regards to rising costs, we still have a healthcare shortage. There's a shortage of nurses, there's a shortage of pharmacists, and there's a shortage of primary care doctors, to say the least. Underestimating cost. My family's kind of guilty of this, not fully understanding how much things cost. And today's consumers are frequently putting money aside for college, and we're putting money aside to buy that first house or maybe the second one, but very few are putting money aside for healthcare expenses. Studies show that there's a deep gap between people's perception and reality of healthcare costs. We're underestimating it by over 100%. Health plan selection, that's part of the problem. That's part of the problem in terms of what you're choosing to be your health insurance. Do you really understand it? Are you selecting the best type of plan for yourself or your family? And do you really have an appetite for how much it costs? Because it's not just the cost of the premium. There are many more costs, which we will actually go over in this presentation. And then the behaviors. We're guilty of managing some of our own health issues, or should I say mismanaging. Those are things that we refer to frequently as modifiable behaviors. You can't change your genetics, but you can change your exercise regimen, what you eat, if you smoke, if you drink excessively, or if you use illicit drugs. So what's the solution to the problem? I don't have the magic wand to figure that out, but I have narrowed it down to a few things. One, consumers need to understand that they're part of the problem and to take some responsibility for their expectations, for what they're asking for from their provider, and to also understand where the costs are coming from so that they manage more appropriately. Understanding the cost, understanding the risk, and understanding some of the healthcare and health insurance terms and calculations can be part of the solution. Health insurance selection is also very important. Knowing your health status and using that information to better understand, what do I really need? How much coverage do I really need? How much do I want to decide what doctors I see, what hospitals I go to, how much care I receive? And when do I want to pay for that? That's kind of what we call your risk tolerance. You want to pay more in the beginning at a higher premium with better coverage in the beginning that you may or may not use? Or do you want to pay less now and perhaps prepare if you need to pay more later? Have you budgeted for any of that? And then with regards to the modifiable behaviors, are you getting your screenings? Are you practicing prevention? How about wellness and guidelines? And in the end, are you living your best healthy life? There's a lot of things that matter to us, but in this presentation, we're trying to emphasize health insurance matters. There's a lot of different ways to get it, because let's face it, health is your most valued asset, and money can't really buy you health, but using it the right way to get the right type of health insurance coverage can help. It can protect the health, the welfare, and the financial future for you or your family. And it can provide you access to doctors, hospitals, and other resources to keep you healthy treat your illnesses, and better manage your conditions. You may get your health insurance from a variety of sources, one more or the other. Whether you're using an employer plan, and employers frequently offer health insurance to attract and retain their employees. And healthy employees work better. They're more productive, they're more attentive, and they show up for work. Government programs. Of course, there's Medicare, there's Medicaid. There are other government programs that are available to veterans and available to certain indigenous tribes. The individual and family programs for health insurance are one that we'll probably go into a little bit more detail. This is known as the marketplace. This is private insurance that you can go online. You can contact a health insurance carrier or contact a health insurance agent, and they will be using the marketplace to buy the private insurance on your behalf. The end game? Well, you want to do it. It matters because it improves or maintains your health. It enhances your quality of life, and it helps the community at large when we're all healthy. Okay, so we know that, as they say, life happens. And life happens, when life happens, it can be kind of costly. One trip to the ER, just to walk in the door and sit on the stretcher, cost $1,000 minimum. And it goes up from there. If you've ever gotten an ER bill, it was probably more than $1,000, but it usually starts there. A broken leg, something we don't see as a major complication, but it can still be up there. I'm not sure if we all have $7,500 just for a broken leg. Childbirth, having a baby is a wonderful experience, but is also costly. It starts with the childbirth experience, and it can be upwards of $8,800. Now, that's just for a normal vaginal delivery. If you're having a C-section, you're talking about $10,000 or more. And then one of the more frequent but costly procedures, hip replacement. This average is actually a little low. In many areas, the cost of a hip replacement is about $40,000 to $45,000. But when you take the average across the country, it's coming in at about $32,000. These examples happen to a lot of people, but they're scary. And so, especially if you have to pay that full amount out of your pocket unexpectedly or even expectedly. Are you ready for that? Do you have the right type of health insurance? Are you ready to use it properly? And are you ready to reduce your out-of-pocket costs to get it? So let's talk about getting coverage. And we mentioned that there are a lot of different ways to get it. There are a lot of different types and options available to you. Frequently, if you're getting your health insurance through your employer, the employer is actually paying part of the premium. You may think it's a little high, but understand your job is actually paying for part of it, and you're paying for the other part. Usually, on average, they pay close to half. You're paying the other half. And frequently, for some employers, they further manage the health insurance costs for their employees based on the actual wage of the employee. So for some employers, people who make more money pay a higher rate, people who make less money pay a slightly lower rate. And you can see the difference in between a single individual plan and if you're buying a family plan with your employer. A licensed health insurance agent. I'm a licensed health insurance agent, and you can contact an agent. Frequently, agents are working with multiple health insurance companies. They frequently can tell you which one of those insurance companies and which type of plan might be best for your situation. It is very specific to your situation. So it's best if you're talking with someone that understands that, or if you're purchasing it yourself online, that you answer those initial questions that are really asking you about your health because they're trying to lead you to what may be the best plan for you or your family. In some instances, insurance agents do specialize where they only represent one company, but in many instances, they represent several. You can call the health insurance agent carrier yourself if you want to. If you know who you want to have coverage with, you can call any one of them. You can talk to someone specifically there who is also licensed, but specific to that carrier only. And many health insurance companies have hundreds of plans, different plan options, so they will narrow it down to what's best for you. Private insurance on the marketplace, there are a lot of different options to choose from there. We'll go over some of them in just a few minutes. And then there are government programs or health insurance plans, and you can see just a few of those listed here. So choosing the best plan, it's not easy, but it's something that you need to try and figure out. Understanding what you need and understanding what's available and the benefits. You can look at the cost of the private or individual health insurance, the plan type. When I say plan type, I'm referring to things like an HMO, PPO, or a consumer-directed health plan. And we'll go over some of those definitions because in the insurance field, we use a lot of acronyms. So everything has an abbreviation. The specific plan that's right for you, deductible, co-insurance, maximum out of pocket. Those may be foreign words that we will review, but those are things you need to know to choose the best plan for you. And you should know, how are they figuring out how much I pay for the premium? Well, it's now based on three things. In 2010, the Affordable Care Act made some significant changes in the health insurance field, where your health insurance premium was based on a lot of things, but now it's zeroed down to three things that really determine your health insurance premium. And that's your age. Older people typically need more care, so your age is a factor. Your zip code, or where you live. Depending on your zip code, there are certain assumptions of it's a healthy zip code or a not healthy zip code, and that influences your premium. And the other big thing that influences the cost of your premium is, are you a smoker or a non-smoker? So here are some of the terms that you will frequently see as you're looking and shopping for healthcare insurance, whether that's on the marketplace or if you're looking at your employer plan or even a government plan. These are things and words and terms that you're going to see. Premium, deductible, copay, co-insurance, maximum out of pocket, lifetime limit. And if you are buying on the marketplace, you will also see the last two, which are premium tax credit and cost sharing. Just to review, premium is what you pay typically monthly for access to the health plan that you have selected. The deductible is usually the total amount that you have to pay out of your pocket before your health insurance plan kicks in. Sometimes you will see plans that have a copay, and you may be familiar with this. If you already have health insurance, you may see this information on your insurance card. It may say you have a copay, for instance, of $20 to see a primary care physician and maybe $75 to see a specialist. And so that is just a flat amount that to access that particular type of provider, you will have to pay out of pocket. There are also frequently copays for ER visits and hospitalizations. Co-insurance only kicks in after you've already met your deductible. And frequently deductibles are for plan year. In most instances, at least for the private insurance organizations, it is the calendar year. So the deductible has to be met between January or before the end of December for the co-insurance to kick in. And that is usually a percentage of what your insurance company will pay after you've paid your full deductible in that plan year. Maximum out of pocket. Once you have paid what is considered the maximum out of pocket for that plan year, frequently your health insurance will then pay at 100%. Most instances, to reach the maximum out of pocket and get something paid at 100%, you had to have a pretty tough year from a health status plan, and you've probably had some type of major significant health issue in that 12 months. There are sometimes lifetime limits, meaning they will only pay up to a certain amount for the entire lifetime that you have that plan. Frequently, these are set at 1 million, 3 million, or 5 million, and it's very specific to certain conditions. The last two only apply to insurance that is purchased on the marketplace. You may hear about subsidy. You have to qualify for that. That's based on your household income and the number of people in your household. And the cost sharing assistance actually only applies to what's called the silver plan on the marketplace. It is a discount that you're provided. We call it the sweet spot. It's a discount you get on the deductible, co-insurance, and co-payments, but only if you're buying the silver plan. These are some other terms that you may hear. Again, there are many terms. These are just the most frequently used. Network. That's the group of doctors, hospitals, and other healthcare providers you have access to with that particular health insurance plan that you've selected. This is a very important term and a very important category to look at when you're selecting a plan. Is my doctor in the network? Is the hospital I want to go to in the network? Are there other things in the network that I need or prefer? And that may drive your decision to some degree. Provider is listed there. In-network. This is a very important term because using in-network providers and in-network facilities will cost you less. Going out of network will cost you more. So if you make the personal decision to use a provider, hospital, or some other professional that is out of network, you are probably going to pay 100% of the cost. Inpatient usually refers to hospitalization or some type of facility you stay at overnight, and outpatient is a non-overnight service provided, usually that same day care, those types of things. Prescription drug list. You also need to look if you are taking prescription drugs as you're selecting your plan. Please remember to look at the prescription drug list, not only for the drug that you take or the medication that you take, but you also need to pay attention to the milligrams of that drug. So for instance, they may cover your drug, but they may not cover the milligram or the amount of the drug that you are taking. So you want to be sure that the formulary has your prescriptions on there, or that you and your physician or provider can make adjustments and you can still get the same benefit that you're getting from the drug that you're on. These are probably the most frequent terms that you will hear, and the ones that are probably the most misunderstood that require explanation. Having worked for a health plan for over 10 years of specific carrier, this is what the calls come in at. People not understanding their deductible, co-insurance, or maximum out of pocket. So the deductible, again, is the amount that you pay before your health insurance comes in. Co-insurance is a percentage. And then once you've met the deductible and you've done enough out of pocket on allowed expenses, you've met the maximum out of pocket, they'll pay at 100%. So I'm going to show you a couple of examples using a deductible of $4,000. So this person has a deductible of $4,000. They have to pay that before the health plan kicks in. Their co-insurance is at 25%. The co-insurance is 25%, which means the insurance company will pay 75%. You'll pay the remaining 25% out of pocket. And after you've paid all that, if it's reached $10,000 total in the plan year, they will pay at 100%. So let's talk about John. John is, he's a jock, a little bit clumsy at times, showing off. And he was playing sports. A girl was on the side, and he broke his arm. So he went to the ER. Fortunately, he was taken to an in-network hospital, and the total cost was $8,000. Now, we're going to assume that $8,000 is $8,000 of the allowed amount that the insurance company will take. So, for instance, if he'd gone to the ER and they charged him $10,000, and that ER is contracting with a health insurance company that he is a member of, they will say, well, it's $10,000. But the insurance company says, we contract with you and we'll only pay $8,000 is the allowed amount. That's where we start. We start from the $8,000. So it's $8,000 allowed amount. He's got a $4,000 deductible. John had to pay the first $4,000 of his medical claim for his broken arm. After that, after he paid his $4,000, the insurance company paid 75% of the remaining amount, or $3,000. John still had to pay another $1,000. So now John's paid $5,000 out of pocket, and he would need to pay another $5,000 before he reaches his maximum out of pocket. And he would need to do that before December 31st, before his insurance company would pay all of his expenses that are allowed for the rest of the year. Here's another example. John's having a bad year. So a couple of months later in October, he's got a ruptured appendix. Rush through emergency for emergency surgery. He's in the hospital for 3 days. Again, lucky guy, he's at an in-network hospital. And now the total cost is $20,000. You can see as we walk through it again, he's already paid his $4,000 deductible. He did that when he broke his arm. And he's already paid another $1,000 when he broke his arm. And so now his co-insurance is going to pay 75% of the eligible amount, $15,000, and John still has to pay some more money out of pocket, another $5,000. Now, John, hopefully he has no more medical issues between October and December, but he's met his maximum out of pocket. So John decides to hang the Christmas lights, and he breaks his hip. Now, if you remember from the earlier slide, that's around $32,000 on the low estimate. John's very, very lucky. He's already met his maximum out of pocket. So even though he fell off the ladder, was in the hospital for 5 days and needed a hip replacement, and he's going to have a long recovery, they're going to pay 100% of that particular medical bill. However, come January, John should probably save his money and be a little bit more careful, because his deductible starts at 0 all over again. Explanation of benefits. This is what a lot of people look like when they first get that health insurance, that bill from the health insurance with regards to their their health care. And so it's kind of scary, but the explanation of benefits, or EOB, you will hear people refer to it, tells you, when did you have care? What care did you have? Where were you? Were you in network, out of network? Who did you see? What types of providers? And how much did that cost? What percentage or what amount of the cost is what the health insurance calls allowed cost or charge? What will the health plan pay? What are you going to be responsible for? And it also has information on the explanation of benefits, in terms of, if you look at it and you have questions, which you probably will, the number that you can call to get those questions answered, to address any of your concerns, or if you feel the information is incorrect, how to do the appeal process. These are the types of health insurance coverages that are out there. So individual, you enroll during open enrollment. That's usually towards the end of 1 year and is for the next calendar year. Open enrollment frequently for many health plans occurs somewhere between October and the end of December. But there are situations where you can do special enrollment, and those are considered major life changes such as birth, death, marriage, or divorce. You can get insurance through your employer. That's frequently called group health insurance. There's also other types of insurance: dental insurance, vision insurance, Medicare, which I will not cover in this particular presentation, but I understand it will be covered in some future webinars offered by the Health Council, or Medicaid and Children's Health Insurance plans. In those, for Medicare and health insurance plan, the CHIP and Medicaid, you can apply at any time if you're eligible for those particular plans. Most plans now, because of the Affordable Care Act in 2010, include what's known as the 10 essential benefits. So you can confirm this when you're choosing, but in most instances, it already is covered. And this is something new that wasn't always in plans. The intent of this particular law was to increase access, affordability, and quality of care. So these are the 10 things that are the essential benefits in your health plans. It will cover emergency services. How much? You need to look at that when you're evaluating the health plan you select. Hospitalization, including inpatient care, lab expenses, mental health and substance abuse. There were a lot of health plans prior to this that did not cover number 4, mental health and substance abuse, or didn't have similar coverage to that as they had for other medical services. Outpatient care, pediatric services, and if it has that, it has to include dental and vision care for children. There are a few states or locations that also provide it for adults, but most health plans do not. That is a separate plan. Pregnancy, maternity, and newborn, including postnatal care. And what I mean by postnatal care is one of the things it covers now is women who need assistance with breastfeeding a baby, prescription drugs, preventive care, and rehabilitative services. So choosing your plan, again, you should be looking at how much health care do I need? How much health care does my family need if you're buying family insurance? Do I have anything coming up in the next plan year? I'm having a baby. I need hip surgery. What are my medications? Are they in the formulary for this plan? Are my doctors there? My hospital there? The specialist that I prefer? Do I want to pay higher premiums now and pay less later? Or do I want to pay lower premiums now and pay more later? Remember, the cost is more than the premium. HMO and PPO. These are pretty frequently used health maintenance organizations, preferred provider organizations, consumer-directed health plans. And we're going to go over those in just 1 minute. I'm going to give you just a few minutes to read about the different benefits, pros and cons of these. It's very important that you understand how they work. HMOs typically cost less. They have lower risk and the premiums are lower. However, the co-insurance is a little higher, so you get a little bit better coverage. The biggest challenge with the HMO is that you have to choose a primary care provider, and that primary care provider is kind of the gatekeeper on your access to specialists. PPO costs more, but you have more flexibility in choosing. You can go to a specialist without a referral. You do not have to choose a primary care provider to get into the plan. You can go to a primary care provider that's in your network. But they don't pay as much when you do get a bill, so you pay more for more choice. And a consumer-directed health plan is a tax advantage plan. It usually comes with what is known as a health savings account. And you really, the deductible and the maximum out of pocket are significantly higher. The money you put in the health savings account rolls over from year to year, and you can use it for different things, including the cost of your premium. You may hear people talk about what we refer to as metal levels. So when you buy insurance on the marketplace, they're divided into metal levels: bronze, silver, gold, and platinum. I'm not sure if you're going to see very many platinum plans on the marketplace, but in some areas you do. Bronze is the least expensive from a premium perspective. However, if you look at this, it also pays less. Some people refer to it as catastrophic coverage. So some people frequently think, I'm insured, I've got a bronze plan. And then when they go to the doctor or go to the hospital, they're really quite surprised at how much they have to pay out of pocket. Silver plans cover a little bit more. The premium costs a little bit more, but it covers a little bit more. And although these are percentages, when you're talking big dollar amounts, this can make a significant difference. It's also the only one that's available for cost sharing. Gold is a more expensive. You will see some gold plans on the marketplace. They cover more in terms of what the plan covers, and you have less out of pocket, but you've paid ahead of time with a higher premium. I don't know anybody right now that has a platinum one, but I did put that on there in case this is something that you would be interested in. You can ask your carrier about that. So you need to look at the health insurance plan that fits you. If you've got a chronic condition, you may want to seriously consider an HMO. Your primary care provider acts like a band leader, and he or she directs all of the specialists to give you more holistic care. If you're very independent and you want to pick and choose when you want to pick and choose, you may want to look at a PPO. If you are a saver and want to roll that money over and over, you're going to have good years and bad years, and you're willing to take the risk on a very high deductible, you might want to consider consumer-directed health plan. And of course, Medicare, you really need to pay attention to when you turn 65, because if you miss that window, you're going to pay more for your Medicare if you're eligible for a Medicare plan. Let me make sure that this stops. Okay. Steps 2, if you decide you're looking at the cost and you're not happy with what you see when you get that explanation of benefits, there is an appeal process. And so these are some of the steps that you can take. Now, yes, you're entitled to an appeal. It is your right to appeal, and you certainly have, you can do it if you like to appeal, but you need to understand the process and the length of time that it will take sometimes to get a decision. Here are a few steps you can take. Ask your insurance company questions to help you understand the claim and address any areas of your concern. Ask, don't demand, a full and fair review of the claim decision, and then you know that it's best not to argue, but to really understand what's going on. If the matter is urgent, the insurance company is actually required to speed up the process. However, after you've exhausted what we call the internal review, which is what you should ask for first, and if you're not happy, you are entitled to have an external review. This is where you're going to go to court. And to do that, you file a notice of appeal, you start paying money for fees and lawyers, you have to provide additional documents to the court, and you'll usually order a transcript with the understanding that this has to go through the state before it goes through the federal. and the state process can take anywhere from 14 to 24 months, while the federal process can take an additional year or two. So be prepared. You may just want, if that's the case, to just negotiate a lower rate if possible. Where does the money go that you're paying for these premiums? 39 cents on every dollar goes to a hospital, 22 cents on every dollar to doctors, 21 cents for drug costs, 8 cents goes for things like dental therapy, hospice, and nursing home, and 10 cents goes to the insurer. The insurer is also responsible for ensuring that the vast majority of your premium actually goes for care of every person that they are providing insurance for. And that's what's called medical loss ratio. Most medical loss ratio, or MLR, indicates that the health insurance carrier, a Blue Cross, a Aetna, a Cigna, whoever you have, has to spend at least 80% of all the premium money that they receive on actual care, prevention, and wellness for the group of people that they insure. If they don't, each one of those people winds up getting a small refund. And I can tell you personally, on one given year, I actually did receive a refund from my health insurance carrier because they had not met the medical loss ratio. So 7 tips for saving money on your healthcare cost. Know when and how to enroll. Don't miss the window of open enrollment. If you don't know it, find out about it. Contact your HR department if you are going through an employer plan. If you're going through a government plan, contact the appropriate government agency or a health insurance agent. Choose the right plan that's right for you. Know how it works. Please, 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 please stay in your network whenever possible. Know how your prescription benefits work. Remember, they're almost 10% of your healthcare costs. Many health plans offer additional perks and benefits. And then there's those modifiable behaviors, which you're responsible for. Not smoking, not using excessive alcohol, exercising, eating healthy, so on and so forth. So just to sum things up, since we're running out of time, the cost of care isn't cheap. We all know that life happens. So health insurance is just one of the many ways that can give you peace of mind, can provide you with expanded access to care, can reduce your out-of-pocket costs, but it's still not free. And it needs to fit your needs. So you need to protect your most valued asset, your health, and make your health insurance work for you. I'd like to thank the Health Council of West Central Florida for the opportunity to talk to you today. I hope I've answered or at least started the conversation on health insurance basics, and I'm going to open it up now for questions.
Thank you, Victoria. So if anybody has any questions, if you would please enter them in the Q&A. If you see that, you'll see that on the bottom of your screen. If you'll type in your questions there, we will pass those on to Victoria. Victoria, one of the things I think maybe we would want to reinforce with folks is that when it sounds like, your insurance isn't paying for anything, it does actually cover all your preventive and screening things right in the meantime. So that's really when you start getting into needing it for sick care.
Yes.
Right? Is
Yes.
that accurate?
One of the things about preventive care, so the 10 essential benefits, the Affordable Care Act said that you can see a doctor for your annual wellness check, and there is no cost. So if you have a deductible or a copay to see your doctor, and that is actually the purpose of that particular appointment, it is an annual preventive wellness visit. There is no copay and there is no deductible. However, the challenge is where things start getting a little fuzzy here is if you use that preventive visit to talk about all your ailments, every healthcare problem that you have, suddenly that visit has changed from a preventive visit paid at 100% to a regular doctor's visit. So I remind my family members, if you're going for your annual checkup, get your blood work, whatever it is you do for the annual checkup. That's it. It's
Right.
not for anything else.
Yes, and that can be, I know one of the things that I faced, so colonoscopies, if you're at the age at which that is something that is covered as one of your screening tests. One of the things that you have to be aware of is that if you go in for a colonoscopy as a screening and they actually find a polyp, it is now then a diagnostic. So you may end up having a copay at that point as well. So I think a lot of these things are still surprises to people, and surprise billing is one of the things that we hear the government working on trying to prevent. But those things, again, making sure you understand the nuances when we talk about some of those preventative and screening things. Similar with mammograms, if you need a digital mammogram as opposed to the standard one, some insurance companies will cover it, some insurance companies don't. So you might want to ask those questions in advance to find out.
Yes, and there are things such as prior authorization. Some things do require prior authorizations. You will see on the back of your insurance card the phone number or how to contact for prior authorization. But when you get that bill, that invoice, that explanation of benefits, don't hesitate to pick up the phone and call your health insurance carrier and ask them to walk you through it. There's no shame in that game, and it's your money, and you're entitled to know exactly what they're asking you to pay.
Excellent, thank you. I'm not seeing any questions in the chat, in the Q&A. Does give that folks a few more minutes to type those in if you need to. I do want to make sure everyone knows that in October session, we are going to be taking a deeper dive into the marketplace plans. So that's the navigating those gold, silver, those metal levels, and how those cost sharings work. So we certainly invite you to join us for that session. That will really get a lot more into those details. Then we're going to be looking at getting to know a local federally qualified health centers, and sometimes these are called community health centers, and we'll be focusing on that as a service provider, which can provide services for folks whether you are insured or uninsured. So there's a lot of options that those with federally qualified health centers. And then in January, we'll be looking at covering kids, using kid care and touching on Medicaid for children. So that will be a very helpful things for folks who are looking to how do we get coverage for our children. And then in March, we are looking at what kinds of services are available for uninsured people. This can include things like county-sponsored indigent healthcare plans. It can be free clinics. There can be mobile clinics, as well as a few other specialty services that may be out there in the various counties in our area, as well as other places for uninsured individuals. And then we will be looking at adding 2 additional sessions a little bit later, probably in April and May, one addressing Medicare specifically, and then one looking at services for individuals living with HIV and AIDS. So we do encourage you to tune in for any of these additional webinars. We will be sending out the slides as well as some resource links for you to everyone who has attended today. So you will have those handy. And we will also be sending you an evaluation form, as well as looking for any feedback that you may have on other types of information you would like to hear about that will help you in your journey to being well and maintaining your health. With that, let me take one more quick check and see if we have any questions. There's no more questions in the chat. So keep an eye out. We'll be letting you know about the upcoming seminars as well. You'll probably be receiving additional information on those, and that you have an opportunity to register for all of them at the same registration link, which is at the bottom of the screen. And again, will be on your follow-up information. So Victoria, thank you so much. You've made a very confusing topic seem a little bit easier to understand. And I mean, I know I've done this for a long time in my life, and there's still times when I'm confused. And so it's always good to have a resource to turn to and somebody to help you sort through that.
Well, thank you. Have a great day.
Thank you
Thank
everyone for joining us.
Thank you, everyone, for joining us.